Hello, my name is Mike Orme and I'm a clinical hypnotherapist based just outside of Bristol in the UK. On the list of hypnosis frequently asked questions, sometimes a patient will say to me, well, what if I don't wake up? Which is it's obviously quite important that you address this one. Because if you think you're never going to wake up, then they're not going to go into trance in the first place. I think the key with this is to get across, and this goes for other concerns and questions that people that I have to field with clients, is that you, the patient, is actually in control, and I'm facilitating you being able to go into a trance, and we do some therapy, and then I help you to come out of that trance. But you're the one who's actually doing it, and I'm just guiding you along, and I'm showing you how to do it. In fact, more often than not, it's not always appropriate, but more often than not, I'm aiming to get a client to be able to do self-hypnosis, so they can actually go away, and after a couple of sessions that they're going to be able to do this themselves at home, when they just before they go off to sleep at night or something like that, and do a bit of work themselves at home. So it's all within your power. You just need to learn the skill, basically. And once they understand that and the penny drops, they think, right, okay. And of course that means that you can wake up at any time. It doesn't have to be at the end of a session. If for one reason or another you just decide that you want to wake up, that's fine. That's no problem at all. And once a client understands that, it's so much easier for them to go into trance. They tend to go deeper into trance, and it's a much more smoother transition once these concerns are alleviated. So the other one that I get sometimes, which is related to this, is, well, you put me into this trance, what happens if something happens to you? And what I would say to them is that, well, I could put you into a trance, and I could walk out of the room and not come back, and eventually you would wake up. It might be a couple of minutes, might be 10 minutes, but you will wake up. And that tends to put the patient's mind at rest. And this is just one question. There's lots of questions like this that people want to ask me when they initially come and see me. And what I've done on my blog is actually address a lot of those sorts of questions, and it's especially useful for people that are thinking, oh well, quite like the idea of hypnotherapy, but I'm not so sure about this, and what about that, and these sort of concerns that people have, quite rightly. So if you go to the blog, you can check out some of the other questions and answers.